Do you know you can get rashes all over your body because of stress? Have you ever felt itchy while you're anxious? Well, this is because of the interplay between the skin and the mind. The skin is the most noticeable and also the largest part of our body. Our minds and skin are so closely entangled, which is what we will be talking about today. Hello everyone, my name is Simran Raghani, a psychology student and an intern under Dr. Sheila Singh, a psychologist at a mental health studio called Talkspace. While observing October as a Mental Health Awareness Month, we are trying to raise awareness around the same with the theme of making mental health a global priority for one and all. The connection between the skin and mind is referred to as psychodermatology. Psychologists and dermatologists are closely examining how psychological stress could affect the skin and vice versa. It is a vicious cycle, and to discuss the connection between the skin and mind, we have with us Dr. Pallavi Sule, a dermatologist and an aesthetics physician. She is also the founder of Dr. Pallavi Sule's Skin, Hair, Laser and Aesthetics Clinic at Powai, Mumbai. With 9 years of experience in the field of dermatology and aesthetics, she is also a featured author with various publications and magazines under her name. Welcome to the show, Dr. Pallavi. It is an honor and our privilege to have you. Good evening, Dr. Sule. How are you doing?
Good evening. I'm doing well. Thank you. How are you?
I'm doing very well, ma'am. Thank you. Welcome to the show. It is a very less known fact that skin problems and psychological disorders are related. Ma'am, we would like to know from you which is the most prevalent skin problem that has a psychological basis.
So there are many skin problems as well as hair problems which have psychological basis. People do not know that the emotions get into the skin, and because of which all the problems start. To name a few which are quite prevalent are like eczema, psoriasis. It can be hair fall due to stress. So basically when we say that there is a psychological problem, it's simple that the person is stressed out. So acne is also one of them, which I have seen quite a few patients coming to the clinic. So these are the ones which majorly I've seen who come with the problems and have to be tackled by telling them that stressors have to be lowered and they have to work on that.
Ma'am, you mentioned psoriasis. So
yes.
How can we identify psoriasis?
Okay, so a very simple term that we use is that psoriasis is skin problem which is of autoimmune etiology, and it is on a red or erythematous base on the skin with silver scaly plaques. So they are very thick plaques on the skin, and this is how you can identify psoriasis. It can be on multiple body parts, or it can be just one side to start with.
Ma'am, what are the symptoms that one can look out for psoriasis or eczema?
So initially people start with a red patch, and then you start seeing those thick scales. Primarily I have seen that patients come in with psoriasis will have them on their elbows and the knees. Also, it can happen after a viral infection. So if the patient has had cold cough or a bout of diarrhea or something like that, they can have it on the whole body. So those are the coin-shaped lesions that you see, same silver plaques on red skin.
Another question is, ma'am, people are usually skeptical about accepting that there can be a psychological cause of such a visible physical ailment like a skin problem.
Yeah.
Ma'am, what do you have to say about that?
So I'll share my experience. Patients do come to me for acne, and not only that they are teenagers, but yes, adult onset acne, and they are not ready to accept that yes, because of some stressors or the type of personality they are, they cannot be easily healed with the medications. So we have to work at a psychological level to lower the stress, to change their not their personality but their way of thinking, or rather we call it the healing ability, and so we can heal the diseases. I have got a patient of acne, psoriasis, vitiligo. So yes, I have seen that it's quite a struggle of making them understand that this angle is also very, very important.
Yeah, lastly, how do you think we can prevent and treat these skin problems which can have a psychological basis?
So very important for today's lifestyle that we are living. To change the lifestyle of a person is very difficult because it is according to their work schedules. But yes, if the person can start sleeping on time, exercising, yoga, meditation, this is how the patient can identify it by themselves and try to work it out at their own level. But something which cannot be tackled might need some help.
Okay. Ma'am, so do you think a psychological intervention is required?
Of course. So when I say that the person might need help is when the focus of the treatment will also include psychotherapy, and which is very, very important. The sessions, if taken, patient heals well, responds to treatment and has beautiful results. And yes, once they learn to manage their stress, the relapse of the disease also not seen.
Okay, ma'am. Thank you. Anything like you would like to tell our audience about the relation between skin and psychological stress that you think is important?
Yeah, I really want to tell my patients and the audience that skin is the largest organ of the body. What you think will definitely reflect on your skin. So if you're upset or not able to manage your stress, then that is going to affect your skin. Problems will keep on happening, will change your hormonal levels, and then so on and so forth. Stresses are going to damage the skin. So it's a vicious cycle. If you're stressed, your skin has a problem. Your skin has a problem, you're stressed, and it doesn't get over. So as and when required, please take help of the experts. They are here to help you. Thank you so much.
Okay, thank you so much, ma'am. Have
Thank
a good
you.
day.
Thank you. I really want to tell my patients and the audience that skin is the largest organ of the body. What you think will definitely reflect on your skin. So if you're upset or not able to manage your stress, then that is going to affect your skin. Problems will keep on happening, will change your hormonal levels, and then so on and so forth. Stresses are going to damage the skin. So it's a vicious cycle. If you're stressed, your skin has a problem. Your skin has a problem, you're stressed, and it doesn't get over. So as and when required, please take help of the experts. They are here to help you. Thank you so much.
Okay, thank you so much, ma'am. Have a
Thank
good
you.
day.
Thank you.